Good morning, everybody. I am very glad to welcome you to the final Plants, Pests, and Pathogen for 2016. So this is going to be a great session. I'm so glad that you all could join us. I wanted to make sure of a few things. First of all, make sure you have your name, your county, and the number of people at your site so that we have an idea of how many have attended. And then everything in the chat box is visible. So try to keep everything that you guys chat about or questions that you have pertinent to what's going on. Leave your microphone turned off, except for when you're speaking, and then it's fine. You can turn it on if you have questions or whatever, but the chat is a really great place for that as well. This session is being recorded and will end up being on the web. It will also be on NCSU Garden, so that you can access it later again at a couple places if there's something that you want to hear again. Also, agents, hopefully you've registered at LMS, but I just want to tell you that I usually go on and check to see which agents have been there so I can get you logged on as well so that you can get credit for it. I've added these instructions, which I've popped up a few times on and off. If any of you have any problems, I just wanted to make sure that you knew sometimes there's been issues with people wondering why they can't do certain things. So I just wanted to make sure you knew that there's some things that you can't do when you're logging on with one of the iDevices. And so just so you're ahead of the game, you understand that sometimes these things don't always play nicely like they should. And so even my own iDevice, which I don't use for this kind of thing, but can be sometimes a problem. You don't see everything you need to. So hopefully that will be okay today. So this is me, and if you guys have any questions later, you're welcome to shoot me an email or give me a call. That's the office number down there. And also I wanted to show you the Plant Disease and Insect Clinic at NC State. There are a lot of good resources here, and I think I put this up every time, but I think it's well worth a visit if you've not been there. Farther down on the page, which I do not have here, there are also some resources that you can go and check, and then the agents are probably very accustomed to dealing with the logging on and being a user. All right, these are the people that we will get to enjoy hearing from today. So we have Mark Blevins, who will come after Matt's session, but we've got a really interesting presentation from him. And then Matt Bertone is going to also be one of our speakers today, but he'll be covering current insects. And then Mike Munster, who will show up. I don't know if he's staying. I know he had someplace to go. Yeah, he's already left. But he will be back later, hopefully in time for his session. And what I want to do is go over, and this may be a little redundant for those of you who are here every time, but there may be some people here who are not here, have not been here before. This is a toolbar which we typically do not use. I'm going to see if I can do my hand. I'm not showing you because I'm like looking at it myself. If you are looking at this right here, we probably will not use this. And so you'll see the picture or the name of the person who's speaking right here. If you are going to ask a question and you have a microphone, you can do that, and that would be hitting the word talk. And there are a few things that are in here. I want to say sometimes when Mike is here, he'll check to make sure that you can hear him, and he'll ask you to do a check. So if you can do that, that's where you would find this. Sometimes if you have questions, you can raise your hand. This is where you would click that you're going to be away, but hopefully that won't happen during this session. And then also, down here is the chat. So if you have questions, you can just type right here, and it will show up there, and that's where you keep things that are pertinent. And then here is the whiteboard. So this is where the entire presentation will show up. And we'll move on. Today this is where we're headed. We've got the intro, which we're in right now. And then today our guest speaker is going to be Matt Bertone, who's going to talk about Delusory Parasitosis. And I'm sure that some of the agents have worked with clients who may have this issue. So I'm hoping that you all will learn a lot about this. And then Mark, I've put Showstopper Plants. Mark is actually is a very interesting presentation today, so I'm excited to see that one for you. And while I have Mike first, I think he's last. some activity, and then I think that Matt is going first. And then we finally have our little update, which I usually have to speed through because we usually come down to the last minute. So, Matt, did you have something you want to say?
No, that's it. I'm probably not going to be talking about much current insects because I'm going to take most of my time covering our main topic today. We will have an activity, like you said, and I will be covering a little bit of the bolo, but Mike will do a regular session on diseases too.
Awesome. Okay. Yay. All right. Thank you. Okay, so this is where we go. You're going to look at your thing on the left. You'll see it over here. It looks like a little star. So if you will, click on that, and you can, some people put smiley faces or suns or whatever you want to put where you're from so we can see where you're coming from. And I know I saw some people from Buncombe show up at the very beginning. So I know there's some people from the west. And there's the smiley face. Okay. All right. Well, that is great. Well, thank you. And so I know there's some people that are actually here from every district. So it's nice to see each extension district represented. Thank you for joining us today. All right, so I have stolen all this information from online, and so I probably will not read every detail, but the thing that I think is most awesome is the thing down at the bottom. But he's an Extension 8 associate in entomology and plant pathology, so Matt is going to talk to us today. But we've got his program area is insect identification systematics. He's got a BS in biology, but the thing that's really cool is he's got a master's and a PhD in entomology. Obviously you know him also from the Plant Disease Clinic, and that he's a presenter for Plants, Pests, and Pathogens as a regular presenter. But the thing that's really cool is the pictures that he takes, and so he's takes some insanely really small things. In fact, one time I went into his office, he had, the very first time I went in there, he had a antenna up on the screen that looked as big. I thought it was an insect itself. It was so big. So very cool photography. So I just wanted to say thank you for joining us as our guest speaker today. And it is all you now.
Well, thanks, Lisa. Yeah, no problem. Now, today's talk will not have a lot of my photos in it. It'll have a few. And I will apologize for the text heaviness of this talk, but I tried to spice it up with some things. And basically, today's subject is a very interesting thing, and one that, like you said, many people encounter, especially as extension agents. Master gardeners may find people that are, looking for help, but I get a lot of these calls and cases, and for Halloween and kind of this time of year also, it's kind of pertinent because it does become more common this time of year. So this is Delusory Parasitosis, and this image right here came from a paper I'll be relying heavily on during this talk. Okay, so first, a couple disclaimers. I am not a medical professional nor a psychiatrist. So all information and advice I give here is based on entomological knowledge and experience with clients exhibiting this issue. This should not be taken as a definitive solution to every case, and clients will need diagnoses from several professionals. So be very careful in what I give you. This is all advice on what I think, how I feel about it, and how I basically handle some of these situations, but there is no definitive source or answers to anything based on this subject. Also, some of this may be a little gross. So hopefully none of you are too squeamish. I'm not going to be showing anything too offensive or anything like that, but it is a subject that is very likely to cause some kind of emotional feelings. So first, what is delusory parasitosis? That's, of course, the first question. From Wikipedia, Delusional parasitosis, or delusory parasitosis, also called ekboms, is a delusional disorder in which individuals incorrectly believe they are infested with parasites, insects, or bugs, whereas in reality no such infestation is present. Individuals with delusional parasitosis usually report tactile hallucinations known as formication, a sensation resembling insects crawling on or under the skin. So basically, in the literature, and different entomologists and scientists will call it different things, but basically I prefer delusory parasitosis. That's the one I've heard of most commonly used as far as from the entomological side, but it is called delusional parasitosis, delusionary parasitosis, delusions of parasitism, delusional infestation, or ekbom syndrome. Now, within the range of delusory parasitosis, there's also another syndrome called Morgellons, which I'll get to in a few minutes. So, now that you know what it's called, you can see that actually, historically, it has been studied by different people, and it's been given names over the years, various names. Many of them, acarophobia, entomophobia, were discarded more because it's not really a fear of insects. It's more of a psychosis or kind of a hallucination or something like that. But it's been called different names by different researchers over the years. Now, one of the most interesting things I think about it, is that it's actually fairly rare according to psychologists and psychiatrists. So the psychological community does not see many cases of this, and this is likely due to people not seeking help. For instance, people often say, I'm not crazy, my friends know I'm not crazy, you know, this isn't in my mind, and so they don't actually go to psychiatrists or psychologists. So most often people do visit physicians, pest control operators, or entomologists and parasitologists. Among others, of course, county extension agents would be included in there. To show this, basically I searched our database for dermatologists, the word dermatologist in any reports. This is not going to capture all of the delusory parasitosis cases, and I'm pretty sure that there are no strict plant cases that have dermatologists in the report. But we have had 87 reports or samples since 2008. So we're talking about basically in an 8-year period, about 87. So we're talking about a dozen cases, 11 cases a year. That's what's in the system. I know I get a lot more calls that don't result in samples and emails every once in a while. So I would say I deal with about a dozen to 2 dozen cases a year of this. So it is actually fairly common, and most pest control operators or entomologists and physicians, dermatologists will tell you that the cases are much more common than the psychiatrists will see. Okay, so I'm going to base, like I said, I'm going to base most of my talk on this paper. It's a very nice paper by a friend of mine, Nancy Hinkle, who is a professor at the University of Georgia, who is an expert in this. She has been a longtime friend of mine, and this is in the American Entomologists 2000, called Delusory Parasitosis. And basically I'm going to be going over this table, which is actually very accurate. I'm going to go step by step, and basically this is going to be I'm going to be talking about the common attributes, so you can identify some of the likely symptoms or likely characteristics of somebody suffering from this. And then we'll go into some, what causes that and how to deal with it. Okay, so first, one of the most interesting things is that it's most common in older people and disproportionately female. So as you see here, this is actually from a different paper, Trabert, 1995. So looked at over 1,000 cases over the years and over a 100-year span. And if you'll note, the majority of cases are from people that are about 50 to 80 years old, and in that range, females make up basically twice the amount of cases. Now, Trabert in his paper basically said the older people, happening in older people, is probably likely caused by many of the issues, health issues that people have, skin issues and skin disorders, things that may mimic insects biting. Now, as far as disproportionately female, I haven't found a good explanation for that necessarily. I will say that one of the things mentioned is menopause as being a cause of that. That may lead to the hormone imbalances may lead to feelings of itchy skin or things crawling on you, and that's actually listed in the table later on when I discuss some of the causes of the issue. And I can confirm that this is typically what I see or what I hear. People who I hear from are elderly women. So that's typically, but of course, there are younger people that have it, and it actually is a fairly 50-50 split in much younger people. And if the younger people that exhibit it usually have other things going on that I'll discuss later on as well. So that's the first part. The second part of the table, so they mostly have similar symptoms or similar behaviors. So quitting their jobs, burning or destroying furniture, abandoning their homes, obsessive laundering, dry cleaning, boiling clothes and bed linens, using pesticides dangerously and repeatedly, and repeated applications of insecticides to the body. Using home remedies is very common, so very harsh chemicals like kerosene, gasoline, solvents, cleaning compounds. I had a person call me who was convinced they were in her scalp and would spray a grocery bag with Lysol and wear that to bed. And so these things are, to them, they feel like this is going to kill, this is going to have the nuclear option to kill everything that's in there, but it's actually just making the situation worse. And lastly, mutilating the body, attempting to remove offending vermin. So often the sores will be caused by people trying to gouge out whatever type of worm or organism they think is in there. And unfortunately, every once in a while, I will have one come to the door and ask me to actually help them do that, which is not something I'm willing to do, obviously. And so I'll tell you some things later on about how to respond to such things. So it's actually very a little disturbing and very sad, and we hope to give them some help. Another thing that are common attributes are they often provide skin scrapings, bits of debris. They often on adhesive tape or plastic bags or vacuum bags. I highlighted this right here. One of the things I like to ask, one of the things I like to try and tell them is, they say there are millions of them, but they can't actually collect a specimen of an offending organism. They also can provide extensive, elaborate, involved descriptions of the pests, their life cycle, and behaviors. They are very fixated on these things, whether they're real or not, and they observe them. So another thing is that I added, they often provide numerous real critters, often coming from outdoors and dying in the house, and they'll basically collect whatever types of organisms they can find, just in case it was that. But none of them are typically biting creatures. However, I should note that you always be suspicious if they're able to collect numerous of the same kind of arthropod. Some of the things I'll be talking about, some of the things that can cause real infestations, but there are always those strange cases where you have some weird beetle that builds up populations and can actually bite people. So definitely be suspicious of anything that's collected extremely numerously of the same species. But if it's just a general collection of arthropods from the home, that's really not evidence for a real infestation. Again, with the tape thing, that is a very preferred way. People will use the tape on their skin or on furniture, things like that, and then tape it to a piece of paper and then submit that to me. Let's see. So here's a typical sample I'll get, something like this, which basically has a note and a number of containers and baggies. These actual little things were little pieces of rubber. So the person had thought that they were some kind of organism that was involved. You can see here sofa, car, kitchen, so they'll basically collect from all over the place, including between their teeth, and sending in bags with very ominous kind of labels, from scalp, between teeth, under toenails, something like that. Which gets really difficult. I have gotten bags full of scabs, and that is not something I will look through superficially. I'll put on some gloves and look through it through the bag, but I will not do that. And actually, if you go on a website, I was sure to, when I began this position, write a document saying that we do not accept bodily fluids, feces, anything like that, because we are not a medical clinic. And so for those things, and another bit of advice for later on too, is that we ask people to isolate the organisms, or have a physician isolate organisms that we will then identify. But we do definitely get baggies and containers full of different things. Okay, now moving to, just going off topic for a second to the different part. This suffers descriptions of what's infesting them, then. There are many different types of things that they describe. The ones with the arrows are the ones I most commonly encounter. So especially black and white, but change colors, jump or fly, so floating in the air, flying, granules about the size of a grain of salt, or little white specks. And that they infest inanimate objects, automobiles, furniture, clothes, rugs, as you saw from those samples, some from the car, some from furniture. There will be people that say, oh, when I go to grab it, it jumps away and it disappears. Or Mike Walvogel told me there was one case where a person said, oh, when I grab it, it actually melds into the floor and disappears. And so they're unable to collect a specimen then, because it's some kind of organism that apparently does that. So this you can see in many things. So this was actually on the outside of the envelope of the sample sent to me. So for everyone to see, please be extra careful. They are very concerned with getting other people infested. So enclosed black and white strands need identification. So then when we see the note that was actually inside, this is a very interesting case. People were very able to describe exact behaviors and reproductive strategies, things like that. So black strands, which are vegans, especially fond of fat, which I find a little strange because vegans don't eat any animal material. And white strands working together, devouring insect and totem. Issues invaded me on my left hand. I examined them under my microscope. I continue after 10 months to continue to have scabs, some on the bottom of the scabs. When I look at breakout under the scope, both the white, a meat organ eater, and the black strands both working together. 90% of the time, the blacks and the white strands are on every insect I examine. So again, they have an idea of what's going on. Many of them do have their own microscopes, or at least magnifying glasses, and they're able to observe these things, but when you get it, you basically just get balls of fiber and things like that. Mostly debris as well, just random debris, plant seeds, little seeds of plants, and again, random insects sometimes, but it's pretty clear they've just collected every type of little thing that they've found anywhere. Let's see. This brings us to Morgellons. I'm just going to sidetrack on Morgellons. This is a specific type of delusory parasitosis. The name was actually coined only in 2002 by a woman who rejected the medical diagnosis of her son's delusional parasitosis. She actually went back in the literature and found this name, Morgellons, and attributed it to it. Basically, most of the physicians, they diagnosed her with Munchausen by proxy syndrome, which is basically, Munchausen syndrome is when you make yourself sick or you pretend to be sick to get attention from doctors. By proxy means you do it to somebody else. So it's a very sad case where the person believes that their children or other people around them are sick. They get them to go to the doctors, and this kind of satisfies some kind of attention-needing thing. It's obviously a psychosis. Now, Morgellons has actually gotten a lot of traction with people. As you can see, all these fibers and skin samples, they basically think that it's this parasite that's multiplying in people, and that the doctors there's been conspiracy from the doctors. They won't actually figure out what it is. I love this bottom part right here that says, note, the Morgellons fibers have purely nothing to do with chemtrails, aliens, Mars spores, self-assembling plastic fabrics, robots, and nanotechnology, or any delusional conceptions, which is interesting, nor they can be produced by mites, worms, flies, springtails, beetles. Most of such statements are just unprofessional and despicable. So they are willing to think that those are all crazy things, but not that these strands are just pieces of fiber. And it should be noted that when people start to scratch and open sores, there's some basically some sticky substance that your body produces, and that fibers can get caught under there. When your skin heals, that can be kind of subdermal, and it may seem like you're being infected by that. And when you search Morgellons on YouTube to look at, I hope you don't sit and watch a lot of these videos because it's kind of strange, but alien fibers, Morgellons explained, nanotags. This is touchless torture devices and mind control targeted individuals, and this is my favorite down here at the bottom. Are you host to an alien parasite? Morgellons is an extraterrestrial filamentous organism that latches onto a human host and takes over their body. Now, one of the problems is that with Morgellons is that there was a video, I think it was one of the ABC ones like this. It came out recently trying to discuss this subject. There were families that were saying they were afflicted with it. And unfortunately, a famous person, Joni Mitchell, also said that she was afflicted by it. And the problem with that is that people believe famous people and that they have completely valid issues. And so basically this just gets perpetuated, and it will probably never go away as far as a real thing. Now, to help make it go away, the CDC actually was getting so many requests to study it that they're like, fine, let's just study it. And so they published a paper in PLOS One, Clinical, Epidemiological, Histopathological, and Molecular Features of an Unexplained Dermopathy. And basically their conclusions were cognitive deficits were detected in 59% of cases. 63 had clinically significant somatic complaints. 50% had drugs detected in their hair samples. 78% exposure to solvents. Solar elastosis, was a most common skin disease or histopathological abnormality. No parasites or mycobacteria were detected. Most materials collected from the patient's skins were composed of cellulose, likely of cotton origin. So basically, there's no underlying medical condition, and it's similar to more commonly recognized conditions such as delusional infestation. So again, Morgellons is just a specific type of delusional infestation, but again, it makes it very difficult to deal with. Okay. Moving on with our table of common attributes. So this is a big chunk of different other behaviors. So social isolation, self-employment, abandoned family to avoid infesting them. I had a person come to my door, and she said, she was very concerned with eggs of worms just shedding off of her everywhere. So they will be afraid of infesting other people. Emotional trauma such as job loss, divorce, or separation have seen numerous physicians to no avail. Now, an interesting thing is the mean duration of the delusion was about 3 years, but up to 40 years in some cases. I would hope that it doesn't go on for that long and people would be able to get help, but it's very difficult. Now again, this is a typical thing, complaining of itching, crawling, pinpricking, biting sensations, or formication, which is basically the feeling that ants are crawling on you. They definitely reject many times reject the possibility of psychological or other explanations. And I've heard this. I'm not crazy. I'm not imagining this. And basically they say, oh, everybody, you can ask anybody you know, or anybody I know that I'm not crazy. And it's like, well, that's not really up for you to decide, but basically let's work on it. Express desperation. You are my last hope. And I get a lot of notes and things at the end saying, please help, exclamation point, things like that. And then, unfortunately, delusions eventually shared by another family member. This is what complicates matters, because if it was an isolated case, if you have a number of people living in a home and only one person is exhibiting this, it's a little easier to say, okay, this person, there's something probably just with them, some kind of health or mental issue that's with them. Once other people begin in the home begin to believe that they are getting bit, it becomes a lot harder to convince that it's not something that's infesting the home. But it's the power of persuasion and basically living with people that are always itching all the time, things like that can make you start to itch. Okay, so some notes. These are some things I get in. As my second sample, still been having a big problem. They're from the bed and sofa. I'm still being bitten. When I say bitten, they feel like bloodsuckers. I found them in my hair, at the root biting. Dermatologist said it isn't head lice or body lice. I have cleaned and cleaned the house and car. I find them crawling on my body. Wash sheets every day. I don't see them on walls. Can't find any place they're coming in the house. I have carpeting and have cleaned it, and I'm the only one in the house they bite. Please help. Find little white eggs on sheets and on car seats. Here's another one. This is a long one. I'll be showing little bits and pieces of over the talk, but this is a very common thing too. They are much more active as the day progresses. So it wasn't on a list. I think it might have been mentioned somewhere else, but you often hear people say they're attacking me at night when I'm sleeping in bed, or when it becomes the evening, that's when they get much more prevalent, and I feel the bites more often. I don't know exactly the explanation for this, but maybe that's when people are at home and kind of in their situation, their environment. I'm not really sure exactly. They don't know either, because they say, I don't know if the artificial light excites them or the time of day. I visually see small black dots on my plastic bed cover around the sinks and anywhere water can puddle. And again, this may not be related, but I did acquire canvas painting from El Salvador this summer. So often they think that an object that they brought into the house was infested, and somehow these things are creeping away from it and biting. Large, white, and liquid was on my lip after drinking a glass of milk. They're in every lotion, every toothpaste, face cream and liquid soap, shampoo, and conditioner. In refrigerator, drinks, pantry, mayonnaise, mustard, and spices. So they're basically everywhere. Now, I can probably tell you that there are very few organisms, if any, that can survive in all of those things. But apparently this is a special type of parasite that's just present everywhere. I will say that certain flies can probably live in some of those things, but they don't normally. So we're not even going to entertain that possibility. please check the container. One has floor sweepings in it. Something is eating the varnish off the floor and has fibers in it that floats in the air. They get on her, feels like fiberglass, and irritates her. She has several sores on her body, and she claims they bite her and her dogs. Twisted cotton on the floor, sores on the dogs. Another one is a leaf of a zucchini bush that appears to have white hair on one side of it. Hey, that might be something everybody here can diagnose. So barring the plant disease, which again they think that's everywhere, like these things attack everything out there. Again, they're saying, you know, they eat inanimate objects like varnish. They're floating in the air, but they create sores on people and on dogs and on zucchini. They create issues. So again, and I think lastly, bites humans and dogs. They're in full floating fibers that feel like insulation. A white dust settles on everything. They take hair and fibers and twist them all together, which also goes along with the fact that most people, when they submit samples, they're often balls of fiber that they mistake for an organism. Our hair morning looks like it has been sprayed with hairspray. Okay. So that's basically what the characteristics of the issue, and basically some of the kind of warning signs that this person may be suffering from delusory parasitosis. If they exhibit a few of these to all of these, it's a good sign of that. But there are obviously real infestations causing similar symptoms, and that's what we're here for. So first, for instance, fleas. Here's an adult cat flea. Here is one of my photos. Lisa, there's one for you. Fleas are obviously a biting insect in homes. They are often found when people have pets. So basically, finding the evidence of fleas is fairly straightforward. So look for the actual adult fleas. Oftentimes these little curved brown, dark red things are the actual adult flea feces. You got little white eggs, and the larvae are little hairy worm-like critters that actually eat the feces of the adults and debris around the home. They are obligate blood feeders, so that means they need to feed on blood, and the host often exhibits small red bites. But people know fleas, so that's one thing. Of course, bed bugs. They are obligate human blood feeders. Hosts may or may not exhibit welts, so some people react to them, some people do not. This could cause that weird, I'm being affected but nobody else in the house is. Now, adults are about the size of a hole punch. That's probably bigger than most people think, and thus they are pretty readily found in homes. And of course, the evidence of that is messy fecal spots all over the place, and colonies, large colonies of these insects in and around beds and where people sleep. But of course, both of those things, and actually there are other Cymicidae in the same family. They're related to bed bugs that when they are away from their host, they will bite people. So they can't survive on human blood, but things like bat bugs, swallow bugs, and chimney swift bugs, I have all gotten samples of. Actually, swallow bug, a friend brought me to photograph. But once their hosts leave, and if they're nesting near a house, the bats or birds, the bugs that don't hitch rides or get to another place will come down into the house and bite people. It may last a couple weeks, maybe, until they die because they can't survive off of people. So it's good to have these specimens to make sure that this is not an infestation that's permanent. But, of course, most of the people who call me and I say that, they say, oh, it's not those. It's definitely not fleas. It's definitely not bed bugs. I would know what those are because, again, those are very common. They're relatively large for biting insects, in the home. Thus, it must be mites. Mites are the most commonly blamed group of organisms in delusory parasitosis cases. Mites are small. People don't really know what they look like very well, and so they basically will blame it because obviously they can't see what the pest is, so it must be something tiny. But it's definitely biting, so it must be a mite or something. So here is an adult northern fowl mite on a toothpick. So they are tiny. They're about the size of a period on a regular page, maybe a little bit bigger. So they're definitely tiny, but they're not microscopic. You can see them with a lens, a hand lens, and I'll zoom in on that in a second. They will bite humans in the absence of the primary host, but cannot survive on humans. And this one is actually, I'll zoom in, this one is actually dark because it's blood-fed off of its host. Can everybody hear me? I see an issue with the sound. Oh. Yes? Okay, I see a check mark, a couple check marks. Great. Okay. So this is an actual bird mite in the family Macronyssidae. Ornithonyssus is the genus. Northern fowl mite is the one. Ornithonyssus silviarum is the one we typically get here. Here's, again, that one on the toothpick closer up. Here are some on a penny. So they are about half the width of a penny. So they are very tiny again, but they are not, they're very characteristic in shape and size, and you will find usually hundreds to thousands of them in a home if they're infested. Here's one again that's blood-fed, and more often we see, or more interesting, if you look under a scope or a lot of the images online, you'll see the ones that are not blood-fed that have these squiggly lines in them. And that's kind of a characteristic that's not specific to these, but it can help identify it as a parasitic mite. Now, there are other Macronyssidae, other Ornithonyssus that infest homes. The tropical rat mite and tropical bird mites are two different species other than the northern fowl mite. But since the year 2000, we have identified only 16 samples containing true Ornithonyssus. I actually had a tropical rat mite last year. We had a couple cases this year in the spring of true northern fowl mites. In fact, one woman came to the door with tape on a paper plate, 5 pieces of tape, and I was like, oh man. And I was thinking to myself, oh gosh, what is this going to be? And on every single piece of tape was a single specimen of a bird mite. And so that made me very happy that I was, they did the same thing, same ways collected, but actually had specimens, and we were actually able to provide help. Just a quick thing as key characters for this genus. They have long, slender chelicerae, but they do still have a claw, like a scorpion pincer at the end. They have a tongue-like dorsal plate, and actually if we go back, you can see that on this one, this tongue-like plate on the top. They have a teardrop-shaped anal plate, and the anus is actually anterior, and they'll have 3 setae there. And then this quadrate sternal plate, which actually, whether the setae are on it or off of it, can help determine between a few different species. Now, of course, mites are very common in homes and around livestock and around pets. And so there are many more mites than just fowl mites or bird mites that are out there that can cause dermatitis. So some it's just the allergies, like even dust mites can cause allergies and itching. Straw itch mites are often blamed. They are predators when the leaves are green, but when the oak leaves, especially in the Midwest, fall and people are raking them up, they'll get these straw itch mites that bite them all over the place, and they're really, really terrible. But it's very difficult to identify and not very common around here, if at all. All different types of mites, on chiggers even people are familiar with. Of course, scabies, that would be a dermatologist would have to be diagnosed that because they are under the skin, but a simple skin scraping from a dermatologist should be able to diagnose them. And often scabies are diagnosed by dermatologists in these cases where delusory parasitosis people go to them because they can treat it with a chemical that doesn't harm the person, and whether the mites are there or not, they're kind of just trying to get them out of the office. And it's a shame, but that's what happens. So you can find a lot of these mites. You can find some of these mites in homes, but they're not necessarily going to be the cause, especially if there are only a few of them. This also leads to a very famous website, birdmites.org, which has a little bit of good information, but a lot of inflammatory information, basically claiming that bird mites are much more common, and when they have the testimonies, it's basically you can very quickly see that the people attribute have a lot of the characteristics of typical delusory parasitosis cases. So if somebody says birdmites.org brought them here, say, well, we can look for bird mites, but if we can't find them, then we have to look for something else. Lastly, one thing that was very interesting that most people don't know, and we've gotten a couple cases of these, are bathyllid wasps, actually. They're very tiny ant-like wasps, about 1 to 3 millimeters long, and they're parasites of pantry or carpet beetles. So often cigarette beetles and drugstore beetles and carpet beetles. So they're often in homes, and they are known to sting people. They actually have a fairly potent sting for their size, and many little ones will be either flying around if they're winged, or the wingless ones will be crawling around, and they can sting. We had one case where they were infested with this cephalonomia that were probably attacking a stored product pest. So again, there are other things that you may not think about. Now, arthropods that do not cause bites but are common in homes and delusory parasitosis samples, things like springtails, scuttleflies, darkwing fungus gnats, carpet beetles, ants, and stored grain pests. So a couple of things to clarify. Ants, although fire ants and needle ants can sting, they're rarely found indoors. Most of the ants that come indoors are not stinging type ants, and they typically don't bite. They're not attacking you. Carpet beetles, people may be sensitized to their CD, but they are not known to bite people and cause welts. Actually, Ellen DeGeneres covered our study and construed that they cause welts. It's a little disappointing. Springtails also, I had a pest control operator came by the other day and said, oh, well, this person's exhibiting these symptoms. I found a lot of springtails, and they're known to cause dermatitis. Well, that's in some of the literature. They say they cause dermatitis, but it's not clarified whether it's the biting or the scales or the actual bodies of the insects sometimes. And I really could not find any primary source that says they bite. In my opinion, and Mike Walvogel's and most professionals, springtails do not bite. They don't have the same type of mouth parts a lot of insects have. They are very common in homes, but they are not a biting organism. And lastly, arthropods that do bite but cannot persist in homes, and they're often blamed. So punkies or no-see-ums, little tiny ceratopogonid midges, and mosquitoes even are blamed. I also get black flies, but all of these require outdoors and aquatic environments to reproduce. They cannot reproduce indoors, and they would not cause long-term infestation. So that's what may cause real infestations or may be blamed. But what does cause delusory parasitosis? Okay. So there are three main groups. The first is environmental or physical causes. It can be as simple as static electricity, various chemicals, including insecticides. So again, somebody may start feeling sensations and start using topical creams or insecticides or things like that, and that actually makes the situation worse. Mechanical irritants such as fiberglass filaments and paper shards, volatile chemicals from manufactured building materials including solvents, fabrics, and fabric finishes, exposure to either water or air. There are actually some people that have disease, or not diseases, but syndromes or issues. Actually, a friend of mine was cold water. You splash on, him with cold water, and he will get little red welts and hives, which is kind of crazy. A lot of people would never suspect that you'd be able to do that, but it does happen. And lastly, just scratching. Any type of random scratch or just beginning to scratch can cause a cascade effect. The next group is physiological causes. So numerous diseases and syndromes can cause one or many of the symptoms associated with delusions of infestation. Sometimes simply allergies or dry skin. And that's actually why I think we get an uptick in cases in the winter, fall and winter, because allergies change, and also dry skin. Like right now, today I was noticing my skin is feeling very dry and itchy. If I were not so knowledgeable about this, I may suspect that there was something biting me. And so just dry skin can cause that. Autoimmune and neurological conditions often cause bite-like sensations. So I had somebody call me and very distraught and trying to figure out this issue. And upon subsequent conversations, I found that this person actually was in a car accident and had severe neurological damage. Well, that is probably the cause of these feelings, and I told this person to go see a neurologist because that is very likely the cause, and please don't keep thinking this is an insect. Go get medical help. Also, like I said, hormone imbalance is rarely thought of, but may be an important factor. And actually, here's a list of some medical conditions, and two of these, menopause and hypothyroidism, are both hormone imbalances or hormone changes in the body that can actually cause symptoms similar to biting insects. Now here's a glossary in the paper. This is again from Nancy Hinkle's paper. So just things, dermatitis is just inflammation of the skin, formication is ants crawling in the skin, erythema is redness, paresthesia is sensation of pricking, tingling, or creeping, pruritus is itching, and urticaria is stinging or burning itch. And so many of these diseases, from again autoimmune diseases, things like cirrhosis, depression, and stress, which are physiological and psychological, which I'll get into in a moment. But all different things can cause these types of issues. Now, if you're taking drugs for certain diseases or syndromes, or you're using alcohol heavily or other drugs, these can also cause bite-like and symptoms like that. There was actually a movie that came out many years ago called Bug, I think. There was about a couple that were taking a lot of drugs and thought ants were crawling on them, and they were restricted to this motel room going crazy. I didn't actually see it, but basically that was the gist of it. So many of these chemicals alone, or these drugs alone, or in combination with others, can cause good movie. Okay, I'm going to have to see it then. Many of these will cause similar symptoms to being bitten by insects. So I won't go down the list. You can see that. I'll send the paper, the link to the paper when I'm done. Okay, now psychological causes. So stress, anxiety, and depression can all cause these symptoms. Itching or grooming is something that we use to soothe ourselves. So itching itself isn't really, or having an itch isn't really evidence that there's an organism present. I really particularly like out of Hinkle this statement here. Although it is generally recognized that stress can induce headaches, high blood pressure, acne, heart attacks, and ulcers, Delusory parasitosis sufferers are reluctant to acknowledge that their dermatological symptoms could be related to stress or depression. So really, it's kind of this social stigma, this social kind of cultural thing where we will recognize certain things being caused by stress, overeating, other behaviors, things like that. But when it comes to our skin tingling, oh no, that's got to be some kind of external force. So another bit about psychological. So loneliness can lead to depression. If there's some kind of feelings, maybe due to chemicals or some physical or physiological cause, there becomes this fixation on these. So every little pinprick or every little feeling you get on your skin is some kind of parasitism. So then you say parasitism, and then you isolate yourself from others because you don't want them to get infested, and the cycle continues, get more depressed, things like that, and it becomes very difficult downward spiral. Itching can actually be contagious, so I wonder how many of you are itching right now or have been throughout any of this talk. Basically, just talking about it or seeing people itch can give them the heebie-jeebies and creepy crawlies. And like I said, even those examining samples or speaking with clients can get the creepy crawlies. And of course, there are true psychoses, and they actually separate those out in the literature as a different form of delusory parasitosis that is based on severe psychoses like schizophrenia and many other types of psychosis. Okay, so finally, what do you do in these situations? And this is the most difficult part. First and foremost, listen. That is the best thing you can do. No matter how crazy the person seems, it's best to hear them out and rule out an actual infestation. Regardless of whether it's delusional, people are suffering. Even if it's in their head, they are really experiencing something severely life-changing and very difficult. And the stress and things like that can lead to more of it. Sometimes the issue can be resolved smoothly, especially if the client is receptive. I had a recent client who on the phone sounded pretty receptive, and when this person came to the door, they presented me with some specimens. I said there's nothing really there, and they were worried that they brought something back from a trip. They hadn't gone too far down the hole, and I was able to tell them, well, it doesn't sound like anything I know. I wouldn't worry about it too much. You might just be a little anxious over it, things like that. And they were able to say, you know what, okay, I'm glad you said that. I was really worried, and now that I know there's nothing to do that, my mind is a little bit more at ease. And hopefully they will recover completely, and I'll never hear from them again. Often the clients have been pushed from expert to expert with little attention to their needs and emotions. Physicians are notorious for this. I don't really blame them necessarily, but they will basically maybe write a prescription and say, here, just take this and be off with you, without, getting the patient really getting the help they need. And it happens a lot. So I get, you're the number that they told to call when this happens. And so on that number, I guess. It is difficult and often a waste of your time, but to the client it may be all that they need to begin recovery. So this is kind of the thing I keep in my mind when I get a call from somebody. It's a lot harder on a Friday afternoon at like 4:30 when somebody calls, and I know they're going to be on the phone for about a half hour at least. Then my patience is a little bit less, but basically, you may see so many of these cases and get jaded, but to them they're the only case, and they're the only ones that are suffering, and they're really, they're going through these drastic things, like I said before, burning down furniture, threatening to move houses, trying to sell their house and move houses in the hopes, or staying at a hotel for months on end and spending a lot of money. It's a very difficult situation. But definitely listen to them first. Okay, so responding to clients. This is very important. And this is all, again, based on what my experience is and what I think people should do, but the different people have different strategies. But first, stress the services you can and cannot provide. You are out there identifying organisms, and that's all you can do. You're not a medical professional, maybe not, maybe some of you are, but basically there's certain things you can and cannot do. Bites themselves cannot be diagnosed. They're dependent on the person, not the organism, real or not. So just like I said with bed bugs, sometimes people get welts. I've been bitten. I've fed a bed bug on myself for photos, and I didn't get any bite. I didn't get a welt or anything like that. Also, depending on how much they scratch, the bites can look different, and different people react differently. So it's based on the people. So I've also often had people ask, "Oh, I have these bites. Can you tell what they are?" I'm like, no, I can't tell at all. Also, if pressed by that, state I'm not a medical professional. So you have to say you'll have to go to the dermatologist or a physician, because I don't deal with human bodies, only organisms that are isolated. And in that vein, again, I can only identify evidence or specimens that are collected and submitted properly. So suggest using sticky traps or a reputable pest control company to find organisms, or have them collect them into a vial of alcohol, and once they get a bunch, then they can submit them as you would submit a normal specimen. Also say, in the absence of known biting organisms, we cannot give control recommendations. We urge you to seek medical advice from specialists such as dermatologists, allergists, endocrinologists, or neurologists. Those are the 4 I list off because they should cover the range of types of issues that would cause bite-like symptoms. Also urge them to discontinue or not use harsh chemicals or home remedies, because that will aggravate the symptoms. So this is our normal response when we, and I've provided some photos on a couple of these text-heavy slides that are very nice, sent from these sets of photos are each from a certain client. So this is the response we send when I get basically debris samples only. Now, if I get some random insects, we'll describe what they are and why they don't bite, things like that. But without any clear evidence of an insect or other arthropod, mite, tick, spider, etc., we cannot conclude that the biting sensation that you're experiencing is actually due to some biting in pest, because we would expect to see direct evidence of such a pest. There are no recommendations for any pesticide applications because there is neither a target pest or target site requiring the application of a pesticide. While this does not mean that the biting sensation is not caused by a pest, many of these cases are often the result of other non-insect causes, possibly related to allergic reactions, chemicals, foods, medications, etc., for which a doctor's diagnosis and advice are more appropriate. We strongly recommend consulting with a dermatologist or allergist. So, so basically that's how we reply, because we do not want people just to spray. Now along those lines, pest control. So pest control companies out there are often either in concert with you or just independently with the client are contacted. Responsible pest control operators should only apply pesticides when an infestation is identified. They may find organisms and treat, but often the infestation returns. So they'll find springtails, and the person is really worried about them, so they'll spray the springtail. They spray for the springtails or something else. But lastly, those that treat without identifying organisms are often doing so to satisfy the customer and probably get some money, but risk substantiating the client's fears and are irresponsible with regard to chemical usage. So a responsible pest control operator really should, of course, if they find some organisms, they can help the person get rid of them. If they don't find any organisms, they spray just in case. That's really pretty irresponsible to just spray chemicals, because they may have some adverse effects on the residents, things like that. And in fact, going back to this one, I've had an exterminator from blank go to my house 3 times. They've identified the bugs as silvertail mites, very small roaches, and buffalo gnats. So silvertail mites are actually, I think, springtails. I've heard people mutilate that name or the common names of some of these insects and arthropods a lot. Very small roaches and buffalo gnats. Buffalo gnats is a common name for black flies in many regions, but I'm not sure exactly what the person is talking about. The treatment was outside and inside. I don't know if any of these are accurate identifications. The silver turnaround or shower were full of them. Okay. Needless to say, I'm still suffering with them, even though their numbers have lessened. So even though somebody came out and sprayed, it doesn't do much. The person will usually have a recurrence of these infestations, and even no matter how many times pest control companies come out, they'll still do it, because obviously there's not really an organism that's doing it. Okay, so a few tricks that sometimes work. So first, be calm at all stages. Remember to stress your role and expertise. And remember again what you can and cannot provide. And don't try and give advice that you don't know, or say, oh, maybe it's this. Just try and say what you can do with with certain specimens or certain samples. I do not refer them to a psychiatrist or allude to it being psychological, because that's one of the easiest ways for them to not believe you in any way, because many are not crazy in their own words. But I do allude to stress and anxiety, which are psychological but more socially acceptable. So basically I say, this could be very, I know you're stressed, but that could be contributing to the situation where you're feeling these bites and you're feeling things all over you, and really stress and anxiety are a huge contributing factor to that. Also, I suggest it's their body. So this kind of takes it away from being in their mind and more blames their body, which they can't control. Blaming immune responses and making them feel like insects and mites are biting them. So blaming an immune response, an allergic response, something like that, to say, listen, this is not in your mind, but your body can react in different ways, and you have no way of controlling it. So this could easily be a health issue. So one of the quotes I heard from a friend is something along the lines of this: just like a heart attack feels like someone sitting on your chest when they're not, the bites you're feeling may feel like bugs but are not. It's trying to convince people, which doesn't necessarily work a lot. But some people, if they're starting to become rational about it, you can say, listen, your body can produce these symptoms that feel like things that aren't there. So why can't it be insect bites that feel like they're not there, that feel like they're there? If they suspect parasitic worms, simply state that you cannot diagnose those. Only a medical professional can. If they start talking about worms or parasites, internal parasites, I say, I'm sorry, without isolating specimens, and also that worms are not my expertise. So in order to get those specimens, they would have to go to a physician of some sorts to isolate parasitic organisms inside of them. So basically it's like, I'm sorry, I'm an entomologist, I only study arthropods and insects. Or arthropods, including insects. Okay. A few more things. This actually works all right, depending on the people, and I've used this as a strategy. Is I often try and reason with their economical side, so both in time and money. So I say, we can certainly look for organisms that will be causing such an issue. However, if we do not find any after searching thoroughly, I highly advise that you begin to pursue other causes of your symptoms. This will save you a lot of time and money trying to treat for a pest, and you may end up ignoring serious health issues by focusing on trying to kill something that we have no evidence of. So basically try and reason with them, saying, of course, that we will try our hardest to find something, but in the absence of that thing, you're going to be going too far down a road that's the wrong way. You're basically going in the wrong direction. And you're going to spend a lot more money and a lot more time, and you're not going to get results. And lastly, you will not be able to help all the clients including this issue. If all else fails, refer them to me. I say that cautiously, but of course you can always refer them to me. And I will gladly speak with them because I've done it so many times that I know, when people are more receptive and when they're not. Now, a few cautions when dealing with clients. Many will be in denial and will believe in a conspiracy by scientists and experts. That is definitely the case. I have had a few, the person was severely agitated and very unwilling to think about what I was telling them. I had somebody on the phone that called me. This was the person who was spraying Lysol inside the bag. Basically had sent off specimens to a DNA facility who came back with flies, and of course the photos were of flies, but they're obviously not anything that could burrow into scalps. And this person said, I said, well, there's nothing like that. And this person said, well, I don't believe you. I know what they're there, and I'm going to be writing a book on it. And I said, well, that's fine. You know, you can go ahead and do that, but I just don't know of anything that would do that with my years and years of training. When pets or children are being treated against their will, it becomes a very difficult situation. I have not had to do this, but if you feel like, and again, this is more for agents and people that are local, where they live close by to the clients, that if it becomes, there are signs that children or animals are being mistreated because this person has delusions, I would call Child Protective Services or Animal Control, depending, because obviously these children and animals cannot protect themselves from people that have these delusions. And if they're using harsh chemicals like kerosene or things like that on their dogs and children, that really should not be allowed. And so you really, I would urge you to call local. And again, for me, it's hard because I'm centrally located. I just see these random samples from all over the place, you know, it's very difficult. But definitely, that is an option. Some may be highly agitated and aggressive, so it helps if others are around to witness and help. It's always good to have a group together. Again, I'm a big guy, so I see this differently. People may listen to me a little bit more when they come to the door because I'm towering over them, and they may not react in a way, but certain people might act aggressively toward you. If the situation escalates, have a plan to get help. That luckily it hasn't come to that, but I've heard of cases where security's had to been called on campus. I really have no advice at extension buildings or anything on what to do in these situations, except for really the best way to protect yourself is just being calm and understanding, but be clear that you're unable to help with the situation. So that's a way to basically help diffuse it, is say, you know, I'm trying, but this is all I can do. If you can produce specimens, I will certainly look at them. Other than that, you know, I really can't do anything further for you. If you'd like to go see a physician, they might be able to help you isolate specimens, but this is all I can do. They will usually be understanding and maybe give up on you as a source and not, you know, keep pushing you to try and solve their problem. And again, most of the people are very understanding and very aware that they're having a big issue and that they don't want anybody else to get hurt, and so it rarely comes to that. Okay, I have Roy. Okay, had a lady who thought she swallowed a bug, and 4 months later still thought it was moving in her stomach, then the back of her head. Had to tell her it was neurological or saliva would have killed it. Said the bug within a minute after taking them. Okay, yeah. Now, actually, there are a few insects that if you swallow can survive in your digestive tract, but it would not last for a long time. And that's another thing. I didn't add some questions to ask, but you know, how long is this going on for? If it's more than several months, this is likely not a real infestation if they haven't been able to identify things that can persist in the home on humans. So things like bed bugs can persist for long periods of time, but they almost never blame bed bugs. Mites, like I said, will not be able to survive that long on humans. Okay, so lastly, is your skin crawling yet? Anybody feeling the heebie-jeebies or anything like that? I do every once in a while, but that should help. And to clear that away, I'll just show you a picture of a monarch butterfly in my daughter's hands, so you don't have to think about these parasites or itching or anything like that. Okay, any questions before I move on to a very short bolo? No questions? Now, I'm sure everybody has stories. And yeah, there's some doozies. So if you see bites or rash, can you assume a real condition? That is incorrect. No. So basically, a bite. Another thing that's kind of parallel to this is spider bites. Everybody talks about anytime they wake up from sleep and they have a little red welt, they think it's a spider bite. Or they're just walking out in the nature and they come home and they got a little red welt, it's a spider bite. Well, spiders don't like to bite people. Also, bites and rashes. Now, if it's a rash, it's something different. And also, again, this is all for a medical professional to diagnose. But bites, you really have to define that. Really, any big red welt could just be somebody focusing on a part of their skin and itching it. And that's going to cause the erythema, the redness, and the raised welt. And if they scratch enough, it's going to open up a wound, and then they can get secondary infections, things like that. You can't assume anything. It could be internal, it could be external, it could be physically caused by the person. And like I said, identifying it to the type of insect is impossible. Excuse me. Basically impossible for many cases. So really, if you see bites or rash, I would say I'm not a medical physician. I can't help you with this. You'd have to go see a dermatologist or your physician to identify what's causing that. Any other questions? Okay. Well, I'm going to move on then. If you have any other questions, you can type them in the box and I'll answer them. But as far as bolo, so fall, winter, as is tradition, unwanted house guests. But guess what? I don't have any photos because I'm going to have you type into the chat or type onto the screen what I would be talking about normally. So unwanted house guests, overwintering insects in your home. What would you normally see? I think I do this just about every year, so I'm just trying to see what people would respond to. So kudzu bugs and lady beetles. Those are two good ones. What are the ones? Stink bugs. Yep. Ladybugs. Yep. There aren't many beetles, but yeah, ladybugs are one of them. Stink bugs, paper wasps. That's a good one. So queen wasps, paper wasps, and hornets will overwinter. You often don't see them coming into the home, but you often see them in the spring when they're leaving. Brown marmoset stink bug. Ants do a little bit, but not a lot. Actually, winter ants are going to be more prevalent now, and they do come into homes more in the winter, but you'll get about the same amount. Bugs look like ladybugs, but are orange. Spiders, somewhat. Spiders are pretty cold tolerant, and they'll be outside. I don't think they come into homes specifically for warmth. They're pretty active. Roaches, yeah, so the smoky browns are coming into homes a little bit more now, but they're kind of going to hibernate outside. And one other thing, so box elder bugs and leaf-footed bugs are another group. Okay, great. Fall cankerworms. Females around Thanksgiving is when they suggest to start banding trees to defend them against cankerworms. You'll often see the males on buildings and near lights. One of the things I don't think I've ever discussed is winter crane flies and fungus gnats. So fungus gnats are not like darkwing fungus gnats, but the true fungus gnats are more orange. They're often found flying on cool days in the fall and the winter. But one of my favorites are the winter crane flies. These only come out when it's cool out, so they only start emerging as adults in the late fall and fly until February or so. Now they look like typical crane flies or even mosquitoes, but they have thin tapering antennae. They have a very short second anal vein here, which is tough to tell, and they actually have simple eyes, which true crane flies don't have. Now it's very tough to see in that photo. Okay. And lastly, most other things are resting for the winter to wake up next year. So things like pupae and larvae. All right, and that's it for me. I think it's Mark now.
Awesome. Thank you. That was really great. And I know that we all got a lot out of that. And probably, like you mentioned, have lots of stories. Okay, so I wanted to move on and welcome Mark Blevins, and so you can see that his the plants thing is going to be a little different today. So anyway, welcome, Mark.
Hey, thanks a lot, everybody. Great job, Matt. And as far as parasitosis goes, so I have had a carved cucurbit on my porch. Now, as I was carving that, I had some irritation on my hands as I was removing the interior reproductive organs and soft tissue from that fruiting body. And so I installed a flaming incendiary device before I threw that away. So that's my jack-o'-lantern story from...
So you invested it.
Yes, to burn that sucker up. That's what I say. Hey, let's chat about pumpkins from my friend Travis Birdsall. He's an extension agent way up in the high country of Ashe County. He works with Christmas tree growers, and one neat complementary crop for them is pumpkins of all shapes and sizes. So they grow those in the winter and work on their Christmas and sell their Christmas trees, and summer, and then sell the Christmas trees in the winter. So he gave me some tips to share with you about growing pumpkins in your own patch. So let's chat about those. Time to harvest was his biggest first thing. So it's highly variable. You'll notice that you're going to take 3.5 months from seed on some of the typical winter type squash. So you gotta plan on that harvest interval. So watch out for that. Now, in addition, specialty squashes, the neat birdhouse gourds, or the giant pumpkins, the loofahs, to shower and scratch off any parasitosis you might have. We're looking at 4 months for that. So if you're going to try to put that sucker in the state fair, then you got to back up at least 120 days from the entry time for your fair. And if you're doing a county fair ahead of that, you got to plant early on these suckers. So watch out for that. Interestingly, growing degree days come into play as well. If you need to find out more about your growing degree days, look at climate.ncsu.edu. The state climatologists are there, and there's charts for everything from frost windows to growing degree days to all kinds of neat meteorological facts. So things that could grow in 65 days here on the coastal plain, it might take 95 days for the same exact lot of butternut squash seed. So you got to plan your harvest, give it ample time for these suckers. Last point on that is the days to harvest on your seed packet is just based on where that sucker was bred. So if you have the same growing degree days, your mileage will be similar, but your mileage may vary significantly if you have different growing degree days from where that sucker was bred. So that's kind of neat and interesting. Planning is important. Also fun to know about is the winter squash are in 3 genera, the standard grown ones, and so we got to be professional on that. That's why I italicized those specific names. The genus is capitalized, the specific epithet is not. All are capitalized, all are italicized, and yeah, so be professional and very botanical. Kabocha is a cooking type pumpkin of Japanese origin, and Hubbard squash, heirloom pumpkins, those funky ones are in Maxima. Peepo has our summer squash, our zucchini, but it also has the standard orange pumpkins and acorns and spaghetti squash. Oh, if you haven't had spaghetti squash, you are missing out. Buongiorno, get you some, and that'll be fun. Cucurbita machata has the butternut and the Long Island cheese, which is also called the New England cheddar. So it's fun to see those relationships and grow them all. Have fun. Now, lastly, plant early was his big suggestion. Travis works with growers a lot on this, and it holds true for your backyard as well. it can be difficult based on high disease pressure from our mildews and insects as well to have consistent organic production. It can be done. I'm not saying it can't, but it's tough to get that consistently year after year. So feel free to start off, but you may need a backup plan if things get tough out there. It's a great reason to plant as early as you possibly can to get out of the way of some of those diseases before they really get bad. So keep that meat thermometer from the kitchen in your garden until you get in trouble for that with the cook of the household. As soon as it hits 65 degrees, put that seed in the ground. Another fun reason to plant early is to have warm days on harvest time. If it's over 70, you don't have to cure those suckers. Some of these growers will cut the fruit off the vine, leave it for a day or two in the field in those warm conditions, and then no need to cure them afterwards. That's fun. After you pick, do store them in cellar-like conditions. So cool, damp, not too wet conditions. Interestingly, the storage intervals are about a month or two for acorn, 3 to 4 months for spaghetti butternut pumpkin, and 6 to 8 months. How great is that? A winter and spring full of blue Hubbard and kabocha. He also suggests that that's the order you should eat them in. So if you grow all these suckers, eat those acorns first, and then move on to the spaghetti and the butternut, and wait on the blue Hubbards for the bitter end of the winter and spring. I'm Mark Blevins with your Showstopper Plants and NC State Plant Update. Enjoy your post-Halloween cucurbit festivities.
Thank you. That was really awesome. I actually learned a lot, so thank you. And enjoyed the different twists for the fall plants. And I see that Mike Munster is back, and so I guess this is ready to turn it over to him. Can you hear us? There you are.
Yes. Give me a green check if you can hear me. I guess I can hear myself, so I'm going to give myself a green check. And I won't say give me a red X if you can't. All right, sounds good. We're getting through. Well, as our interactive presentation activity today, we went with our good old standby of critter or not. We could call this a special holiday feature presentation. Just a few, and then I'll go and talk about diseases. Matt and I, as usual, will be tag teaming on this, although we didn't actually decide who was going to do which one, so I guess I'll just carry on. Again, if you have not done this before, the way it works is when we show a slide and describe a situation, you decide if you think that it is a critter, that is an insect, a mite, a spider, a mollusk, or some vertebrate animal, or is it not a critter? In other words, a disease, a fungus, some kind of abiotic problem, environmental, man-made, etc. Keep track of your score as we go along, and for those of you who are participating as a group with one joint login to the system today, take a vote and have a secretary record your votes and give us the majority opinion. So there will be a green check or a red X will be, again, the available choices. I'll clear those out, and we're ready to go. First situation, this is from Raleigh, from a nursery, Verbena, I believe it was, and the grower brought this in concerned about these structures that are on the, in this case, underside of the leaves. Critter or not? Give us a green check if you think you're dealing with a critter, and a red X if you think it is something else. How many logins do we have today?
Is that showing right? That is a 53, does it?
It says there's 45 in the main room, so that can't be right.
Yeah, I think that's. I think there's a glitch.
All right, well, let's see what happens when I post it.
Okay.
Pulling. Publish responses to whiteboard. No, that was a number 6, not a 50. So we have 6 who said that it was a critter and 17 who said not. And a number of abstentions. Well, in this case, the majority rules, and it was not a critter. These, in fact, are fruiting bodies of a slime mold, possibly the genus Didymium. And one of the clues here that it's really not interacting with the plant is you notice that they're just superficial, and there's no kind of discoloration, necrosis of the plant tissue. This is, again, a slime mold, so the plasmodium just oozed up onto these leaves, converted into the spore-producing bodies, and used the plant as a substrate, or not as a substrate, but just as a support. The other thing that you would possibly think this could be would be a tiny little mushroom, which can happen, but not very often. This was on an ornamental grass that came in earlier this year. It started out as little bumps that I thought were insects, referred it to Matt, but then he bumped it back to me, and I bumped it back to Lee Butler because it's a grass. But the little bumps became little mushrooms, and in this case it would eventually develop the parasol and the gills underneath, which the other ones, the slime mold, which would not do. The spores would be produced inside that little water tower dome and not on any kind of gills. Here's another slime mold picture. This one came in this month, or this past month also, and it was from a windowsill of all things. But Stemonitis, as a slime mold, really does like woody substrates, and will tend to fruit there, produce its sporangia. Not sure which species this is, but again, it just happens to be there. But again, Stemonitis does occur very often on wood. We've seen it on windowsills before. In fact, I used it in critter or not at one time in the past. I've seen a picture of it even on wood flooring. If you're interested in this group, it is really fascinating, and there's some wonderful pictures online in what's called the Photo Gallery of Myxomycetes that University of Georgia has. And I'll type this in. I don't know how it got moved to the Fishes of Georgia website, but that's where it is. Oops, I can't see what I've typed. Well, I'm going to have to owe you that one because it's not letting me. Well, let's just move on. Just use your web search for Photo Gallery of Myxomycetes and pick the one that's associated with the University of Georgia. So we're talking not about the aphid. Ignore her, him, it, but the other structures that you see there. The filaments with the whitish tops. Clearing. Oh, I'm sorry. Okay, start again. I just cleared that out. Okay, about 5 more seconds. And we'll publish it. Even fewer people were daring enough. I guess the sugar-induced sleepiness from all that Halloween candy has people unwilling to respond, but those who did, again, the majority is correct. these are the stalked eggs of the green lacewing, and I'll let Matt say a word or two.
Yeah, so green lacewings in particular, there are a couple other lacewings that produce short stalks, but green lacewings in particular, basically they'll lay their egg and they'll attach their rump to the surface, and then a little sticky substance made of silk, they draw that out and then lay their eggs on these flexible stalks. And the stalks are both to keep ants from eating them. They're covered in a little bit of oil that repels ants, and also to keep them from eating each other because they are predatory and cannibalistic. And so you see these rows, or even sometimes there's a cluster with a bunch of eggs on the end. They're pretty diagnostic for green lacewings.
And the aphid obviously is now very worried. But you know this is not a fungus. There are a couple of fungi like rhizopus that kind of sort of a little bit look like this, but the egg is elongated in this case, and in those it would be rounder and it would eventually have dark spores in it, and also you would see mycelium down there in or on the substrate. So this is clearly not that.
That was strange.
Okay, let's clear our responses. Oh, not sure why it wasn't clearing. All right, I don't know. Lisa, could you try and clear out the old responses? For some reason it's not doing it when I click on it.
I'm going to check. It seems like everything's
there
gotten
it goes.
slow.
Okay. So what we have here is azalea. It's actually right here on campus, just a few steps from our building. And we have stippling on especially the older leaves, progressively worse as you get down on the lower leaves. Are we dealing with a critter or not? Give us a green. So maybe a little bandwidth problem. Also, maybe I'm wrong. Here I am saying that people aren't participating, and maybe they're trying desperately to get their vote in, and it's just not being registered. If so, my apologies. Give another couple of seconds.
Yes. Okay, there I am.
All right.
Yeah, so this is the azalea lacebug. Most people are familiar with it.
There was almost an overwhelming
on the top
support
of the
for the
leaves
idea
as
that
a
this is
result
a
of
critter.
them feeding on the bottom of the leaves.
You're right.
Where the adults, the nymphs,
Take it away, Matt.
are present, and they will lay eggs in the tissue, and basically a very common pest of azalea.
And are we seeing eggs here?
It's hard to say. They do leave a lot of fecal spots that are black and shiny, that are large. And maybe the eggs, I'd have to see them a little bit up closer. But the eggs so some of the, especially like oak lace bugs, have really big upright eggs that you can see very clearly. Azalea lace bugs have less obvious eggs, but you can still find them.
So these would be the fecal pellets then. They're shiny and kind of amorphous.
Yeah, there's a mix of all different things like skins from the young, eggs, and fecal masses that are like shiny black. So it's difficult to tell sometimes, but the whole suite of things basically shows lace bugs.
And if you're lucky enough to catch them in season, the adults are actually quite pretty.
Very pretty.
So here we have an anthurium plant, and this one's a little different scenario. It came from a greenhouse in Buncombe County in North Carolina, and I don't remember what time of year it was, but I think it was earlier this year. So we're talking about these structures here, 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 here. Do we have a critter or not? All right, that should be enough time here. And once again, majority is correct. This is not a critter at all. This is a leaf spot caused by the fungus Macronyssidium roridum, which is a problem on several different plants in the Araceae. Here it's anthurium, but Dieffenbachia, for example, gets it pretty bad. But it also gets in some other things like begonia and even our pansies and violas. So we had a sample come in last week from a landscape. These had been installed, these violas had been installed the end of September, and they were having all kinds of problems. And despite having applied a granular fungicide at planting, they had pythium root rot pretty bad, and also some myrothecium blight on the I saw it on some stem and crown tissue. Rhonda M. Gusser, no fair big picture totally revealing. Well, yeah, of course, if I had showed you the spots, then you would have figured it out. But actually, most people did, so very good. Clear the board here, and I will say nothing more about this one other than the fact that it is willow oak from NCSU campus earlier this year. Are we seeing the consequences of a critter or not? All right, let us see. Okay, so we have 21 plus 8 is 29, correct. In other words, this one was both. So count yourself as correct no matter what you said. There were two things happening here. One is iron chlorosis. The pH of the soil at this site was 7.7, which is ridiculously high for our part of the state, and pretty much any part of the state. And as you know, if the pH is too high, iron, even though it's present in the soil, is tied up in a form that's chemically unavailable for root uptake, and the new foliage develops yellowing because of the lack of iron. We call that iron chlorosis. Apart from that,
yeah, so the aphids, it's a Stegophylla is the genus. There's a couple species up on the East Coast, but they attack oaks only. They're a waxy aphid with very small cornicles, or the little kind of pipes on the back. They're pale, and they'll often be found in these curled leaves, and they infest the leaves very early on when they're buds. And so they may even be gone by the time you notice the curled leaves. Oftentimes you'll still see a little bit of wax and maybe some shed skins, and that will be your only evidence that they're there. But if you catch it in time, you'll see little colonies of them in the curled leaves.
And this picture, I think, was back in June. I'm not sure, but again, it was fairly early in the growing season. So total yourselves up, and I'll change the polling type to A through E. So give us choose a letter A there if you've got one correct, B for 2, C for 3, D for 4, and E for all 5. The choices are up there. What used to be the green check and red X are now the A, B, C, D, E choices. So you click on the box that should show a small lowercase a in it, and then below there, pick what letter you're gonna respond with. Let's see, we had about 30 who were doing it. So we're now at almost 20. Give me a few more seconds. So, a good job. Nobody at least admitted to getting none correct, and most people got either 3 or 4, and 5 got all of them correct. So, congratulations. And believe it or not, we have an encore performance here of correct or not. You don't need to write anything down here. And this one's not going to be choose a yes or no, but if you have an idea here, look in or type into the chat box what you think the situation is.
This is, I'm going to tell you, this is a Halloween treat. This is a coconut-covered marshmallow. This is actually much more kind of disgusting than that, and maybe goes into our Delusory Parasitosis case. But this is actually a friend of mine's under his cockroach colony, which he feeds rat chow, which are big pellet-like things, had hundreds, well, thousands of book lice all over it, which is pretty creepy, and that's part of your Halloween experience, even though it's a little late. This is a huge infestation of book lice on a really nice piece of food for them. So anyway, not a plants, pests, and pathogens necessarily thing, but I thought it was kind of interesting because when I posted it, everybody thought it was a coconut-covered marshmallow.
All right. So I chose for, now I'm going to segue over here into our disease portion. We don't have very much time, but I only have a few slides to show. And one of the things that I wanted to do was mention a few things that I learned while at the Ornamentals workshop last week up at the Cayuga Conference Center near Hendersonville. Every 2 years, the people who work on diseases and pests of ornamental plants get together and have a powwow up there. And I came back with some updates that I want to share. One of them is the latest on rose rosette from research by Mark Wyndham and others, and there's a huge multi-location, multi-researcher effort going on rose rosette. But just a few things here that were mentioned by Mark Wyndham in his talk that haven't really changed that much. We've been talking about this for a while, that constant vigilance is important for the appearance of rose rosette symptoms. And when you do see them, that roguing is an effective strategy for maintaining gardens with minimal losses if used judiciously. But you do have to get those out of there in order for it not to spread. Again, this is not going to persist in the soil. It's not going to spread by pruners. So if you get the infected plant out, and you can put another plant in immediately as soon as the weather conditions are good for that. They have, in their research, found that a green barrier can give some protection. I don't remember, to tell you the truth, if they just had it on the windward side of the plots or all the way around, but they were using miscanthus grass, and it seemed that there was less rose rosette in the somewhat isolated rose beds protected by that grass barrier. They're going to see if that holds up in further work now that their grass barriers have grown. And pruning is a crapshoot, was his term for it. It may work, it may not. And what they found is that if you see the very first symptoms, that first elongating shoot that keeps its red color, and you prune all the way down to the crown, that will be effective 68% of the time. If you wait 4 to 6 weeks before you prune, that's only going to be effective 30% of the time. So you only have a pretty narrow window to be able to get pruning to work, and even then it's not a guarantee. So they basically consider it ineffective. But if you've got a rare genotype, something that you need to try and save, that's an option. Prune it in that way, and then also take some healthy canes to propagate and see if you can keep it going. There's much more to say about rose rosette, but I think it's best to wait until some of the further work is complete on it. And we've had presentations on this disease before in Plants, Pests, and Pathogens. You can go back into earlier sessions and listen to those. Another thing that they mentioned was to try and reach a greater audience than what they were with their web pages. They have got now a Facebook page for combating rose rosette, and this is also combating a lot of misinformation that's out there on the internet about this disease. So if you're a Facebook user, look for the Combating Rose Rosette Facebook page. Another thing that came up, not as part of one of the talks, but as a question to Steve Oak after he was talking about decline diseases, and well, actually he was talking about a number of diseases, including oak decline. But someone asked about the problem with rhododendrons, not apparently just restricted to North Carolina, but up into Virginia as well. And this is a picture that came in from a sample that Jerry Moody submitted, Avery County, back in June, and his comment was this as he submitted: "This is happening in the woods and large home lots all over in the mountains. It is taking out established plantings of rhododendron, and we cannot find a reason. Good luck." In this particular case, the sample did come into the clinic, and Sean worked it up, and all he found was Botrysphaeria on a branch, no root disease. So you ask, well, what is the stress? What's happening? And even though this was a sample from back in June, there was some light shed on it here at the meeting last week. And basically, Steve Oak, formerly the U.S. Forest Service, or State Forest, no, it's U.S. Forest Service, I believe it was. He had worked on this some, and his comment was this: that what's happened is that the rhododendron stands have been undisturbed since they got established after large disturbances, fire basically, years ago, and that these are often now clonal, and now they're getting old. Insects and pathogens basically have a buffet set for them, he said, with these old clonal stands of rhododendron. So you get things like armillaria, shoot insects, but not associated with Phytophthora, he said. And his last comment that I noted was that we haven't provided the conditions for rhododendron regeneration. So we've got basically old stands that are subject to this decline issue. Also, there was some talk about boxwood blight, so I wanted to mention that once again. Make sure that everybody is looking out for this. October, of course, was prime season for detections of this, and our map has changed a little bit since the last time I showed it to you in August, basically adding Wilson County, which had a landscape confirmation of boxwood blight this in the time since our last Plants, Pests, and Pathogens. And the situation there was a little interesting. We didn't see the typical dark brown, well-defined lesions on the leaves. Those were absent in this particular sample, so this is an older picture. But that particular sample, if anything, the leaves just kind of got a little bit of browning to them, little drying up before they fall off the plant. And here you can see the sporulation actually, but that's, if you don't have a microscope or a lot of experience, that's going to be hard to use as a criterion. The things you want to use if you don't see the spots are the fact that so many leaves are falling off and these dark streaks on what should be the green stems. That's your real clue. Those two things, the three things with the spots are your clue to a boxwood blight diagnosis. This is the sample as it came in, and notice that it's on the lower foliage and the upper leaves are still hanging on there, but that kind of top-heavy appearance is fairly typical of boxwood blight. Now, let's see, do I have another picture here? I know. What I wanted to mention out of the conference that came up with boxwood blight was some unsettling news, I'll put it this way, from Georgia, where the pathologist there was mentioning a landscape that boxwood blight diseased American and English boxwoods had been removed and replaced with thousands of dollars of Korean boxwoods. After removing the soil and torching the ground to try and burn away the fungus that might be there and plant what should have been resistant types of boxwoods in their place, but they had a very wet period and the replacement shrubs got hit hard by boxwood blight, even though they were supposed to be resistant, even though there were fungicides being applied. So it's not clear exactly what happened in this case, why, if it was just the environmental conditions were too favorable or what exactly is going on. I think they may still be going out and looking into that there in Georgia. I'm not planning at this point in changing our recommendations without knowing more, but it is a cautionary tale. And speaking of tales, one of the things that she mentioned, Jean Woodward, who made the comment, told me afterward that while working with this client, the client's cat had been weaving in and out through the boxwoods and actually had a fallen leaf stuck to its tail as it was going through there. So even domestic animals may be means of the fungus moving locally. Just finish up with a quick be on the lookout for list for our diseases between now and the next time we meet in February. So pretty much the only vegetables that we'll have in the garden this time of year are our crucifers, where you need to be aware of Sclerotinia stem rot, xanthomonas or black rot, a bacterial disease, and on turnip white spot, another fungus. With the woody ornamentals, apart from all the abiotic problems that there may be for planting and so on, but you may still be seeing entomosporium leaf spot on Photinia, if there's any Photinia still left out there, and on Indian hawthorn, Cercospora or Pseudocercospora on ligustrum, that's pictured here on the left. Phytophthora root rot, of course the fungus is going to be less active in the cool weather, but the consequences may be there. And I put an asterisk here because even though, as Victor Borga said, prediction is difficult, especially predicting the future. But I'm a little bit concerned that after the flooding from Hurricane Matthew, that we're going to see some Phytophthora get a foothold, start to be rotting roots now and in the spring, and then start seeing the consequences when the hot, dry weather moves in next summer. So we'll have to wait and see what that brings, but I'm a little bit concerned. Armillary root rot, of course, any time of year you might see that. The mushrooms are probably gone now. Chuck did bring in some just this week. Rhizosphaera needle cast on spruce, boxwood blight, which we just talked about, and Septibasidium, or the felt fungus. Remember, that's one that just colonizes scale insects on trees and shrubs. But I put that here not because it's necessarily active now, but now that the leaves are falling off our deciduous trees, or will be soon, things like Septibasidium will be more visible because the trees are bare, and as will some other things like black knot. And mistletoe, which we should be on the BOLO list, both in our trees, and you want to especially be careful that it may be hanging from a door frame near you. Flower beds, black root rot on pansy and viola could be causing problems. And finally, botrytis blight, which we can get in the pansies as well, and it looks pretty terrible when that sets in. So, for the first time in a long time that I can remember, we are finishing exactly on time. Are there any questions? Matt, I see that you put something in
Tim
the...
Matthews just emailed me, and it's a really good resource.
Yep,
it says a lot of the same things that I do in a nice kind of format. Basically, a lot of the recommendations are similar to what I suggested. It has a little bit more information, but definitely search online for more strategies and basically descriptions of the issue. But you know, that actually outlines some nice recommendations at the end.
Okay.
So if there are no questions, I'll turn it back over to Lisa.
Well, I would like to thank the 3 M's, Matt, Mike, and Mark, for making this year such a great plants, pests, and pathogens, and the Plant Disease and Insect Clinic, always such a great contributor. So thank you very much for everything this year, and I'm looking forward to that for next year. So anyway, thank you everybody and for attending, and so we'll go ahead and end this session, and then I've just got a bit of review.